Hip dysplasia is a condition that affects the hip joint, causing it to be improperly formed. Imagine the hip as a ball and socket joint. In a healthy hip, the ball fits snugly into the socket. But in hip dysplasia, the socket part of the joint is often too shallow or irregularly shaped. This means the ball part of the thigh bone doesn't sit securely in the socket. As a result, the joint can become unstable, leading to a range of problems. There are different types of hip dysplasia, depending on when it develops and how severe it is. The most common form is developmental dysplasia of the hip, also called DDH, which occurs in babies and young children. This type can be present at birth or develop in the first few months of life. In some cases, hip dysplasia can also appear later in life, particularly during the teenage years or early adulthood. Hip dysplasia is more common than you might think, particularly in certain populations. In newborns, it occurs in about 1 in 1,000 births. However, milder forms might go undiagnosed, especially if symptoms don't show up immediately. The condition is more prevalent in females, with roughly 80% of cases occurring in girls. This disparity is due to how the female pelvis develops and responds to hormones during pregnancy. In adults, hip dysplasia is less common, but it can still develop or be diagnosed later in life, often due to early signs being overlooked or misinterpreted. Causes of hip dysplasia. The exact cause of hip dysplasia isn't always clear, but several factors can contribute to its development. Genetics play a significant role. If a parent had hip dysplasia, their child is more likely to have it too. This hereditary link suggests that certain genes might make the hip joint more prone to developing abnormally. Another contributing factor is the position of the baby in the womb. Babies who are in breech position, where the buttocks or feet are positioned to come out first, have a higher risk of hip dysplasia. This is because the abnormal position can put extra pressure on the developing hip joints, preventing them from forming correctly. The environment in the womb can also influence the development of hip dysplasia. For example, in cases where there isn't much amniotic fluid, the baby may not have enough room to move freely. This restriction can affect the proper formation of the hip joints. Hormones may also play a role, especially in girls. Female infants are more affected by maternal hormones that relax the ligaments during birth, which can increase the risk of hip dysplasia. These hormones make the ligaments more flexible, which can be beneficial during childbirth, but they might also make the hip joints more susceptible to dislocation or improper alignment. Lastly, certain cultural practices can contribute to the development of hip dysplasia. For instance, in cultures where babies are swaddled tightly with their legs straightened and together, there is a higher incidence of the condition. This is because the practice can prevent the natural development of the hip joints, leading to problems later on. Symptoms of hip dysplasia. The symptoms of hip dysplasia can vary depending on the severity of the condition and the age of the individual. In newborns and infants, the symptoms might be subtle and easily missed. Parents might notice that one leg is longer than the other, or that their baby's hips make a clicking or popping sound when moved. The child may also have a limited range of motion in the affected hip, making it difficult for them to spread their legs apart when changing diapers. These signs can be early indicators of hip dysplasia. As the child grows older, other symptoms may become apparent. A toddler with hip dysplasia might develop a limp or have a waddling gait. The child may also experience pain in the hip, groin, or thigh area, especially after physical activity. In some cases, the pain may radiate down to the knee, leading to confusion about the origin of the discomfort. This is because the nerves in the hip and knee are connected, and pain can be referred from one area to another. In adolescents and young adults, untreated hip dysplasia can lead to more severe symptoms. The individual may experience chronic hip pain, which can become more intense with physical activity. This pain is often described as a deep ache in the groin or outer thigh. The person may also feel a catching, locking, or clicking sensation in the hip joint. Over time, the abnormal wear and tear on the joint can lead to early onset osteoarthritis, which is characterized by joint stiffness, swelling, and a decreased range of motion. For older adults, the symptoms of hip dysplasia are often similar to those of osteoarthritis. The person may experience persistent pain in the hip and groin, which can worsen with activity or after long periods of sitting. The hip joint may feel stiff, making it difficult to move the leg or perform daily activities. As the condition progresses, the individual may develop a noticeable limp, and the range of motion in the hip joint may become significantly reduced. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of hip dysplasia. Diagnosing hip dysplasia typically begins with a physical examination by a healthcare provider. In newborns, this often happens during routine checkups. The doctor will gently move the baby's hips and legs to check for any signs of instability or abnormal movement. Two common tests used in infants are the Ortolani and Barlow maneuvers. The Ortolani test involves gently pushing the hip back into place if it's dislocated, while the Barlow test involves gently pushing the hip out of the socket to see if it dislocates easily. If either of these tests indicates a problem, further imaging tests may be ordered. In older children, adolescents, and adults, the diagnosis process might start with a discussion of symptoms and a review of medical history. The doctor will ask about any pain, limping, or other issues with the hip. During the physical examination, the doctor will check for signs of limited range of motion, pain, or instability in the hip joint. Imaging tests are crucial for confirming a diagnosis of hip dysplasia. In infants, an ultrasound is often used because it can capture detailed images of the developing hip joint. This test is non-invasive and safe for young babies. It allows the doctor to see how well the ball of the hip fits into the socket and whether there are any signs of misalignment. For older children and adults, X-rays are more commonly used. In some cases, advanced imaging tests like MRI or CT scans may be needed to get a more detailed view of the hip joint, especially if surgery is being considered. Treatment for hip dysplasia. The treatment for hip dysplasia varies depending on the age of the patient and the severity of the condition. Early diagnosis and treatment are crucial for the best outcomes, especially in infants and young children. For newborns and infants, the primary treatment is often non-surgical. One of the most common methods is the use of a Pavlik harness, a soft brace that holds the baby's hips in a position that allows the joint to develop properly. The harness is usually worn for several weeks or months, depending on the severity of the dysplasia. The goal is to keep the ball of the hip joint in the socket, allowing the socket to mold around it as the baby grows. Regular checkups and ultrasounds are done to monitor progress and make adjustments as needed. In cases where the Pavlik harness is not effective, or if the diagnosis is made later, a different approach may be necessary. For older infants and toddlers, a closed reduction procedure might be performed. In this procedure, the hip is gently manipulated back into place while the child is under anesthesia. Once the hip is in the correct position, the child is placed in a body cast, called a spica cast, to hold the hip in place while it heals. The cast is typically worn for several weeks, and follow-up x-rays are done to ensure that the hip is stable and developing normally. In more severe cases, or if non-surgical treatments are not successful, surgery may be required. There are several surgical options, depending on the specific needs of the patient. One common procedure is an osteotomy, where the surgeon cuts and realigns the bones to improve the fit of the hip joint. In some cases, the socket is deepened to provide better coverage of the ball of the hip joint. Another surgical option is a hip arthroscopy, where the surgeon uses a small camera and instruments to repair any damage to the joint and improve its function. For adults with hip dysplasia, treatment often focuses on managing symptoms and preventing further damage to the joint. Physical therapy is a key component of treatment, helping to strengthen the muscles around the hip and improve the range of motion. Pain management strategies, including medications and lifestyle modifications, can also be helpful. In cases where hip dysplasia has led to significant joint damage or early onset osteoarthritis, surgery may be necessary. Total hip replacement is a common option for adults with severe hip dysplasia. In this procedure, the damaged hip joint is replaced with an artificial joint, which can provide significant pain relief and improve mobility. However, hip replacement surgery is usually considered a last resort after other treatments have been tried. It is worth noting here that maintaining a healthy weight is a key factor in managing hip dysplasia. Excess weight can put additional strain on the hip joint, worsening symptoms and accelerating joint damage. Now, we want to hear from you. Do you or someone you know have hip dysplasia? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.